on delivering care closer to home. Now, the future of the NHS is the greatest concern to my constituents in Telford, because local health bosses have been deliberating for the last 5 years on whether to move our A&E and our women and children's services out of borough in a project that they have named NHS Future Fit. Now, on the 29th of January this year, local health bosses announced that they will indeed remove these services and transfer them 19 miles away to the other side of Shrewsbury, and that they plan to create, in addition, a new super hospital on the same site. The project is going to cost a record £312 million. Now, my opposition to this project has been long-standing because it does not meet the needs of local people. It does not improve health outcomes, and it does not focus on narrowing health inequalities. And I believe that if local hospital management understood the people of Telford better, they would not have come up with this plan. Telford is a rapidly growing new town, with people coming to live here all the time, and it's an area with pockets of significant deprivation, and by any measure it fares significantly worse when it comes to health outcomes, life expectancy and numbers of children living in low-income families than does the Shropshire area, which fares better than England's average, and when it comes to measures of deprivation. There is, in my view, some very important points that we have to consider when making a transfer of assets from an area of need to an area of affluence, because such an action is wholly inconsistent with the ethos and obligations of the NHS. Now, some have called my opposition parochial and territorial, and if I somehow better understood the plans, then maybe I would view them in a different light. But as a former non-executive director of a hospital trust, and as someone who has been working with constantly changing senior executives of the local hospital trust, engaging in the detail of this plan since the inception in 2013, my opposition is based on the understanding of the healthcare landscape and local need. I would just like to make three points before I complete. We have to ask the question, does this scheme meet the needs of local people? Is there any evidence that health outcomes will be improved? Is there any evidence that we will narrow health inequalities? Will out-of-hospital care make up for the reduction in planned medical beds and hospital staff? Put simply, it may look good on paper, but will it work in Shropshire? So I have asked the Minister to call in this scheme for review, and I very much hope that he does so.
Dr Philippa Whitford.
Thank you very much, Madam Deputy Speaker. I welcome